Hello everyone, Dr. James Whittaker here, and today I'm going to share with you 5 essential penis care tips that every man needs to follow to ensure optimal sexual health and performance. For those who stay until the end, I'll also reveal a crucial 6th bonus tip that many men have never heard of, but can make all the difference. These 5 fundamental tips will essentially summarize what every man should do to avoid sexually transmitted infections, penile cancer, erectile dysfunction, and Peyronie's disease. By following these guidelines correctly, your sexual health will improve significantly and you'll maintain optimal function well into your later years. What I'm about to share isn't just theoretical advice. These are evidence-based recommendations that I've seen transform men's sexual health and confidence in my clinical practice. Each tip addresses specific aspects of penile health that are often overlooked but are crucial for maintaining proper function throughout life. Too many men take their sexual health for granted until problems develop. By implementing these preventive measures now, you can avoid many of the common issues that affect millions of men and maintain peak sexual performance regardless of your age. Understanding penile health fundamentals. Before we dive into the specific tips, it's important to understand that penile health isn't separate from your overall health. It's an integral part of your cardiovascular, hormonal, and psychological well-being. The penis is a complex organ that requires proper care and attention to function optimally. Many men don't realize that the penis contains specialized erectile tissue that needs regular oxygenation, proper blood flow, and appropriate care to maintain its health and function. Like any other part of your body, neglect can lead to problems that become increasingly difficult to address over time. The tips I'm going to share address the most common causes of sexual health problems: poor circulation, inadequate hygiene, physical trauma, psychological factors, and lifestyle issues. By addressing these areas proactively, you can prevent most sexual health problems before they start. Tip number 1, keep your penis active, avoid disuse. The first essential tip is to keep your penis active and avoid disuse. This principle applies to every organ in your body. Use it or lose it. The penis, like your brain, muscles, or any other organ, needs regular stimulation and oxygenation to maintain optimal function. Regular erections are crucial for penile health because they bring oxygen-rich blood to the erectile tissues. Without adequate oxygenation, these tissues can become less responsive over time, leading to erectile dysfunction and other problems. When I talk about keeping your penis active, I'm not just referring to sexual intercourse or masturbation, though both are beneficial for penile health. Men who don't engage in regular sexual activity can maintain penile health through other methods. For example, vacuum penile pumps can be used therapeutically to promote erections and blood flow. Pelvic physiotherapy can also help stimulate circulation and maintain erectile function. Some men benefit from specific exercises that promote blood flow to the genital area. However, a healthy, regular sex life remains the most natural and effective way to maintain penile health. Regular sexual activity promotes blood flow, maintains tissue elasticity, and supports the complex physiological processes involved in erectile function. The key is consistency rather than frequency. Regular, moderate sexual activity is more beneficial than sporadic, intense periods followed by long periods of inactivity. This helps maintain the vascular and neurological pathways involved in sexual function. Tip number 2, maintain proper personal hygiene. Although this may seem obvious, proper penile hygiene is absolutely crucial and cannot be overstated. Many men don't realize that poor hygiene is one of the leading risk factors for serious conditions, including penile cancer. In many countries, poor penile hygiene contributes significantly to the incidence of penile cancer, which is largely preventable through proper care. The main risk factor for this serious condition is inadequate cleaning and the buildup of smegma and bacteria. Proper hygiene involves daily cleaning with neutral pH soap or glycerin soap. Avoid harsh soaps or chemicals that can disrupt the natural pH balance of the genital area. The cleaning should be gentle but thorough, paying particular attention to the area under the foreskin if you're uncircumcised. After cleaning, it's essential to dry the area completely. Moisture trapped in the genital area creates an ideal environment for bacterial and fungal growth, which can lead to infections and other complications. One important aspect of hygiene that many men overlook is washing after sexual intercourse. The vaginal pH is different from penile pH, and exposure to these different environments can cause changes in your local bacterial flora, potentially leading to infections or irritation. Make it a habit to clean the genital area with warm water and mild soap after any sexual activity. This simple step can prevent many common infections and maintain optimal penile health. Before we continue with the remaining crucial tips, I want to ask you to hit that subscribe button and ring the notification bell. I regularly share essential men's health information that mainstream medicine often overlooks, but that can dramatically improve your quality of life and sexual health. Don't miss out on this vital information. Tip number 3, avoid sexual activity with partial erections. This third tip is something many men don't consider, but it's crucial for preventing long-term damage. Men should be careful about engaging in sexual intercourse when their penis is only partially erect or in a semi-erect state. When the penis is only partially erect, it's much more susceptible to trauma and injury. A penis that's partially flaccid and partially erect lacks the structural rigidity needed to withstand the pressures and movements of sexual activity safely. This vulnerability can lead to repeated microtraumas, small injuries that may not be immediately apparent but accumulate over time. These microtraumas can cause the formation of scar tissue or nodules within the erectile tissue. Over time, these nodules and areas of scar tissue can lead to penile curvature, a condition known as Peyronie's disease. Peyronie's disease can cause pain, deformity, and significant erectile dysfunction, often requiring surgical intervention in severe cases. The solution is simple but requires discipline. Only engage in penetrative sexual activity when you have a full, firm erection. If you're having difficulty achieving or maintaining full erections, this is a signal to address underlying health issues rather than proceeding with partial erections. This might mean taking time to ensure proper arousal, addressing stress or anxiety that might be interfering with erectile function, or consulting with a healthcare provider about potential underlying health issues. Tip number 4, avoid excessive pornography consumption. The fourth essential tip addresses a modern problem that's affecting increasing numbers of men: excessive pornography consumption. While this topic might be uncomfortable for some, it's crucial to address because of its significant impact on sexual health. Excessive pornography use can cause sexual desensitization, essentially rewiring your brain's response to sexual stimuli. Men who consume large amounts of pornography often become dependent on the intense visual stimulation and specific scenarios presented in pornographic material. This dependence can create serious problems with real-world sexual performance. Men may find themselves unable to become aroused or maintain erections during normal sexual encounters with partners because their brains have been conditioned to respond only to the artificial stimulation of pornography. This phenomenon, sometimes called porn-induced erectile dysfunction, is becoming increasingly common, particularly among younger men who have been exposed to high levels of pornographic material from an early age. The solution involves gradually reducing pornography consumption and allowing your brain to reset its sensitivity to normal sexual stimuli. This process can take weeks or months, but the improvement in real-world sexual function can be dramatic. Instead of relying on pornography, focus on developing genuine intimacy and connection with partners. This approach leads to more satisfying sexual experiences and better long-term sexual health. Tip number 5, maintain healthy lifestyle habits. Perhaps the most important tip is maintaining healthy lifestyle habits, because sexual health is directly connected to your overall physical and mental health. Your lifestyle choices have a profound impact on sexual function and performance. Diet plays a crucial role in sexual health. Foods that support cardiovascular health also support sexual function because erections depend on healthy blood flow. A diet rich in fruits, vegetables, lean proteins, and healthy fats provides the nutrients necessary for optimal sexual function. Proper hydration is essential for maintaining blood volume and circulation, both critical for erectile function. Dehydration can impair sexual performance and reduce sensitivity. Regular exercise improves cardiovascular health, hormone production, and stress management, all crucial for sexual function. Both cardiovascular exercise and strength training contribute to better sexual performance and confidence. Sleep quality directly affects hormone production, particularly testosterone, which is produced primarily during deep sleep phases. Poor sleep can significantly impact sexual desire and performance. Stress management is crucial because chronic stress elevates cortisol levels, which directly suppress testosterone production and interfere with sexual function. Most importantly, avoid smoking and limit alcohol consumption. Smoking is a major risk factor for erectile dysfunction and Peyronie's disease because it damages blood vessels and impairs circulation. Excessive alcohol consumption can also impair sexual function and hormone production. Let me share a case study that illustrates the power of implementing these tips consistently. David, a 52-year-old executive, came to me with multiple sexual health concerns: inconsistent erections, reduced sensitivity, and anxiety about performance. David's lifestyle included many risk factors: high stress levels, poor diet, irregular exercise, excessive alcohol consumption on weekends, and what he admitted was probably too much pornography use during business travel. His hygiene habits were adequate, but not optimal. He often rushed through showers and didn't always clean thoroughly after sexual activity. He also frequently engaged in sexual activity despite not having full erections, thinking this was normal for his age. We implemented all 5 tips systematically. David committed to daily proper hygiene, including post-sexual activity cleaning. He began a regular exercise routine and improved his diet significantly. He gradually reduced pornography consumption and focused on building intimacy with his wife. Most challenging for David was waiting for full erections before sexual activity, as this required patience and communication with his partner. However, this change proved crucial for his recovery. The transformation was gradual but significant. Within 3 weeks, David reported improved energy levels and better sleep quality from his lifestyle changes. His morning erections, which had been inconsistent, became more regular and stronger. By week 6, David's erectile function had improved dramatically. The combination of better circulation from exercise and diet, reduced performance anxiety from avoiding partial erections, and improved sensitivity from reduced pornography consumption created a powerful synergistic effect. After 3 months, David reported that his sexual function was better than it had been in years. His confidence had returned, his relationship with his wife had improved significantly, and he felt more vital and energetic overall. David's case demonstrates how these seemingly simple tips can have profound effects when implemented consistently and comprehensively. The key was addressing all aspects of sexual health simultaneously rather than focusing on just one area. I want to hear from you in the comments below. Which of these tips surprised you the most? Are there areas of penile care that you'd like me to address in future videos? Have you noticed connections between your lifestyle habits and sexual health? Your questions help me create content that addresses the real concerns men face. The bonus tip: sleep without restrictive underwear. Now for the bonus 6th tip that many men have never heard of, but that can make a significant difference in long-term penile health. Develop the habit of sleeping without underwear or with very loose-fitting underwear. This recommendation is based on the physiology of nocturnal erections. Healthy men experience multiple erections during sleep, particularly during REM cycles. These nocturnal erections are important for maintaining penile health and function. When you wear tight or restrictive underwear to bed, it can compress the penis during these natural nocturnal erections. This compression can cause trauma to the erect penis, leading to micro-injuries that accumulate over time. These repeated microtraumas can create areas of fibrosis, scar tissue formation, within the erectile tissue. Over time, this fibrosis can develop into penile curvature and contribute to Peyronie's disease, a condition that can significantly impact sexual function. By sleeping without underwear or with loose-fitting boxer shorts, you allow nocturnal erections to occur naturally without compression or restriction. This simple change can prevent a significant amount of long-term damage. If you're not comfortable sleeping without underwear, choose loose-fitting boxers made from breathable materials like cotton. Avoid tight briefs or compression underwear for sleep, regardless of what you prefer during the day. Beyond these essential tips, there are additional considerations for optimal penile health that men should be aware of. Regular self-examination is important for detecting any changes in the appearance or feel of the penis that might indicate health issues. Look for any lumps, bumps, changes in color, unusual discharge, or persistent pain. Any concerning changes should be evaluated by a healthcare provider promptly. Early detection of problems leads to better treatment outcomes. Temperature regulation is another important factor. The testicles need to be slightly cooler than body temperature for optimal function, and excessive heat can affect sexual health. Avoid prolonged exposure to hot tubs, saunas, or tight clothing that increases genital temperature. Consider the impact of medications on sexual function. Many common medications, including some blood pressure medications, antidepressants, and antihistamines, can affect sexual function. If you're experiencing sexual problems and taking medications, discuss this with your healthcare provider. Certain environmental and occupational factors can impact penile health. Men who spend long hours sitting, particularly in positions that put pressure on the perineum, the area between the scrotum and anus, may experience reduced circulation to the genital area. If your occupation requires prolonged sitting, take regular breaks to stand and move around. Consider using a cushion designed to reduce pressure on the perineal area during long periods of sitting. Exposure to certain chemicals and toxins can also affect sexual health. If your work or hobbies involve exposure to industrial chemicals, pesticides, or other potentially harmful substances, ensure proper protective equipment and follow safety guidelines. Regular medical checkups play a crucial role in maintaining sexual health. Many conditions that affect sexual function, such as diabetes, cardiovascular disease, and hormonal imbalances, can be detected and treated early through routine medical care. Don't wait until problems develop to seek medical attention. Preventive care is much more effective than treating established conditions. Be honest with your healthcare provider about any sexual health concerns, as early intervention can prevent minor issues from becoming major problems. Consider annual testosterone testing, especially after age 40, as low testosterone can significantly impact sexual health and overall well-being. Blood pressure and cholesterol monitoring are also important because cardiovascular health directly affects sexual function. To implement these tips effectively, create a personal sexual health plan that addresses all the areas we've discussed. Start by honestly assessing your current habits in each area. Sexual activity frequency, hygiene practices, lifestyle factors, and sleep arrangements. Identify the areas where you need the most improvement and prioritize changes that will have the biggest impact. For most men, lifestyle factors like diet, exercise, and stress management provide the foundation for all other improvements. Make changes gradually rather than trying to transform everything at once. Sustainable improvements are more valuable than dramatic short-term changes that can't be maintained. Track your progress by paying attention to improvements in sexual function, energy levels, mood, and overall well-being. These improvements often occur gradually, so keeping track helps maintain motivation. By implementing these 6 essential tips consistently, you're not just improving current sexual function, you're investing in long-term sexual health and preventing many common problems that affect men as they age. The circulation improvements from regular activity and healthy lifestyle habits help prevent erectile dysfunction. Proper hygiene prevents infections and reduces cancer risk. Avoiding trauma prevents structural problems like Peyronie's disease. These preventive measures become increasingly important as you age, when many men begin experiencing sexual health problems. By establishing good habits early and maintaining them consistently, you can enjoy optimal sexual function well into your later years. The 6 essential penis care tips I've shared with you today: keeping your penis active, maintaining proper hygiene, avoiding sexual activity with partial erections, limiting pornography consumption, maintaining healthy lifestyle habits, and sleeping without restrictive underwear, form the foundation of optimal sexual health. David's case demonstrates how powerful these simple but essential practices can be when implemented consistently. By addressing sexual health proactively rather than reactively, you can prevent most common problems and maintain peak performance throughout your life. Remember that sexual health is an integral part of overall health. The habits that support sexual function also promote cardiovascular health, hormone balance, and general well-being. This makes investing in sexual health a smart decision for your overall quality of life. Start implementing these tips gradually but consistently. Choose one or two areas to focus on initially, then expand your efforts as new habits become established. The key is consistency over perfection. Small, sustainable changes produce better results than dramatic but unsustainable efforts. If you found this information valuable and want to take control of your sexual health naturally, please hit that like button and share this video with other men who need this essential information. Subscribe and ring the notification bell so you don't miss future videos about men's health topics that can transform your life and relationships. Your sexual health deserves the same attention and care you give to other aspects of your well-being. Take action today to implement these essential penis care practices. Your future self will thank you for the investment you make in your sexual health right now. Thank you for watching, and remember, optimal sexual health is achieved through consistent daily choices, not quick fixes. Make those choices count, and I'll see you in the next video.